Okay, I'm in St. Joseph's Nursing Home. It's Monday morning. I believe it's the 12th of March, and I was woken up for a blood test a little earlier, and they've been giving me, against my will, some psychiatric medicines and other medicines. They gave me an injection first day on the 7th, I believe, or the 8th, and said it was to relax me, to anti psychotic drugs. And then before they left me leave on Friday, they gave me some injection of Haldol, which I'm wondering if it isn't some kind of a time release thing that I'll be suffering from for a week or something like that. And ever since they gave that to me, maybe for half hour after that, I started having ringing in my ears. I think they call it tinnitus. I didn't remember having this before, or and if I cover my ears, I still hear this ringing. It's something in my body. I don't know if it's from my food or from something else. I don't remember having it before, and I can't take this picture very well, but maybe I can do it in a tricky, not be clever here and take this picture so you can see what I'm talking about, the wheelchair. They give me this wheelchair, and you saw already that there's nothing in my room, none of my clothes, nothing. Not my walking stick cane, my support cane, which if it was here, I would have it to go from this chair to the toilet, which to do that I have to get up and walk from here to there, and I almost don't have anything to hold on to easily, so I end up being at risk of falling, and of course there's no solution to that. Now that I've come in here, I'm going to sit down and try to urinate, but suddenly I get a burning sensation wanting to urinate, which happens occasionally. I had been having this burning before when I was taking all these medicines they give me, except for the psychiatric ones. I managed to get them to realize I shouldn't have had them ever prescribed to me from the beginning of this, being in this nursing home and hospital. But some demon or some ungodly idea in their minds is wanting me to, but you see, there's the chair, there's the door. Now how am I supposed to get that chair through the door? Well, I can't. And here's my diaper. Hasn't been changed because they haven't given me a clean diaper since I got into this room, which has been now this Monday from Friday. Or maybe I changed it once in the hospital ER. No, I guess it has been changed at least once because I came back with a non-pull-up blue diaper. So now I'm having similar trouble urinating. Although the last urination I just did about 10-15 minutes ago was okay, this one was a little unable, a burning sensation and unable to go, which is, this isn't exactly like it was in the past, but it's why I'm wondering, do I have a urinary tract infection? Because one of the symptoms of that is of course I'm burning and itching in the groin area. And of course if I scratch it or do anything to respond to it, then it will itch more. It may be because I'm allergic to the powder they put in these diapers that absorbs the moisture, or something they add to them inside to help deal with that process. I'm just recording all this so that I have documentation of what's going on here. I'm not very pleased with the treatment I'm getting here. And I know that others aren't, and maybe some others aren't pleased and they're not even astute to describe what's bothering them, or certainly don't have a way to record it. I know that I'm not the only person suffering from this poor treatment, quality of treatment. And when I have to get up, stand up to pull my pants up, which I'm doing right now, the problem is that I can't, I don't know if I'm dizzy, or if to say I'm dizzy, or to say that I'm unable to really feel secure. I widen my feet, try to stand a little pigeon-toed to not fall. So now in order to buckle my pants, I have to lean against the wall, the tissue dispenser. Of course, I don't want to fall. I want to not do anything that's going to create any opportunity for my stay here to be longer than it has to be. Toilet flushing. Now I have to go back to the chair. Try to anyway. And this is how I have to walk. So I probably shouldn't be holding the phone, but otherwise I have to leave it on the sink. Now I'm documenting this. I'm hoping that I'm not going to be considered insane for doing this. Apparently I'm insane because I had the smell in my room that I didn't cause. They caused it by taking all my, giving me food. I have pictures of it and a video of it that I've posted, and leaving it there, taking it out of the freezer, giving it to me, and telling me to do something with it. That was 2 or 3 weeks ago, maybe 4 now. And then the next day I was going to go to, well, it would have been around the 11th of February, I guess. But maybe about that. And then what am I supposed to do with it? Well, I set up Access-A-Ride to go the next day. I hadn't gone for a week and a half with Access-A-Ride at least. And I set it up to go. I was going to take it the next day in the morning and put it in my freezer at home. But then I was all set up around 11 o'clock or 12 to get picked up. And they decided to have a meeting that morning. And that's the meeting I have videotaped and recorded, and I posted it on YouTube. And then the psychiatrist came in there late to the meeting, so we started saying things, and then when he came in, we started to repeat them or try to get him in, but he came in sort of, I would say, disheveled, and he agreed when we started the meeting. Oh yes, you can go out. And then by the end of this little meeting, where people said things that weren't true, and I mentioned it to the doctor, that they're basing their information on incorrect facts, then he sort of felt that I was doing what he called psychotic ruminations, I think is what he said, but we'll see, it's on the tape. And I wasn't that. And then they said, well, you're excused now, you can leave this meeting room and we'll finish up without you. And I said very emphatically that I would rather stay there and hear what they had to say about me. But then they called the code blue and made me leave. Had the security come take me, and of course they had already said you can't go out. So I couldn't take the food to the apartment, put it in the freezer. It had been frozen. It was in the freezer here, and they were complaining that the refrigerator was too full of stuff, meaning the non-freezer part. The freezer part had plenty of space in it. I was only using a little bit of it for frozen food, but they insisted that they brought it all to me, insisted I do something with it. The next day I was going to take it back, and they wouldn't let me take it to my apartment, put it in the freezer. They made me stay here. Since then, they wanted me to take they came the next day with that thing they called a contract, which was just if I do what they want me to do, and then I can go out. If not, then I can't go out. Leave on my own, or I don't even know whether it means just on my own or with someone or what the situation is. And I ended up not being able to go back until finally last Friday. She set up another inspection for me, and I went, and that didn't work out right, and I may lose my Section 8 because of that. I don't know. I hope not. And then when I was there at the apartment, that Antoinette called me and said, it was around 2 o'clock in the afternoon, she said, oh, well, I'm not going to help you anymore because you don't listen to me, you don't agree with me, you make problems. I hadn't created that problem. I told her that when she set that up, that it was a foolish idea to go there and try to do that they had told me from McCrite, which does the inspections for Section 8, that they should, that I should, when I get back into the apartment, I'm there permanently, then call them and they'll set up an inspection. I tried to tell that to her. I did tell her on the phone. I sent a text. Then she sent another text back to me. I put them on the YouTube, and I have copies of that. And so then she said, well, I could take care of myself, solve the problem myself. She apologized for having hung up on me earlier that day, which I didn't realize she hung up on me. I thought I was having a cell breaking of the cell, interrupting, because I wasn't hearing everything she said. I wasn't hearing it because it was whatever the cell phones do when they break up. I guess that's what it was. I have to guess a lot of this stuff. And she asked me if I was on my way, because the Access-A-Ride had come for me, but they didn't come to the right door. They went to the hospital door instead of the nursing home door. And then I tried to call Access-A-Ride, and it takes 5 minutes to get through to them to finally talk about what it is, because they ask you all these questions. And then I was trying to tell them to call the driver, contact the driver, and have them come to the other entrance. The driver took off. By the time they got a hold of them, the driver was gone and said I was a no-show, which I was not a no-show. The guard, Gary, was there in that morning, and he saw it. He's the one who told me that they were driving up to the hospital entrance. And it was the stormy weather, that it was going to be maybe a blizzard, maybe not. And I don't think it turned into much of a blizzard on that day. I think we had the blizzard on Sunday maybe, but I don't remember exactly. It's too much to remember all these things. So the problems in my room, then because people kept telling me it smells in your room, it smells in your room. I said, well, I don't know if it smells, because once you're in a area with a smell for about 4 hours, then your body doesn't notice it anymore. You don't realize there's a smell. But what does it smell like? What are you smelling? What do you think the problem is? And they don't know. I don't know. And I had discovered that this stuff that they brought me was in one of my bins, and I hadn't moved it out because I was too involved thinking about other things. And then I said to myself, well, I don't want to take this and throw it out just now, even though it smells. I want to document it with my phone and have other people see it before I get rid of it. So I cleaned it up good. I put it in another smell-proof bags, the blue ones that keeps odors, and I put it back in the room. And then the guard, the one nurse that is very sensitive to the odors, he wants to come in and open the window. I said, well, does it smell as bad or the same or different? And he acknowledged that it didn't smell so bad. So I was assuming then that smell was coming from that bin, which I don't know if I noticed it or not, because after 4 hours you don't notice the smell. I don't know if it gets stronger if you notice it or not. Sometimes that's a problem with gas leaks, that people smell it and they don't realize it, or they realize it, then 4 hours of smelling it goes away. Maybe that's not true, but I assume it might be. So I'm saying all this and doing all this, and now I need when I went on Friday, I got all the things I need, the herbs and the spices and my potassium pills, so I could take the potassium while I'm eating all this salty food and keep my potassium sodium balance correct. And I was doing that for some time period. I had some potassium in different food forms before that, and when before I got sick, that I had a little bronchitis somewhere around the end of January, I decided to stop taking the medications I was being given. Nothing psychotic at that point, but I was given 7 pills. I've documented this, but then sometimes it was 4, and sometimes it was 7, sometimes it was 3, and one time there was 8 or 9, and there was a pill in there that didn't belong to me. And I told the nurse, she said, "Oh no, those are all yours." And now I said to her again, "Well, take a look, let's see," because she was a part-time nurse at that moment, or fill-in, or from, I don't know. I don't remember exactly who it was now, but I know it wasn't the normal nurses. And what did she end up seeing? Checking it on the book where it says what she should give me. And she said, "Oh, you're right," and she took it back. And then it concerned me, because I doubt the fact that that happened was ever recorded by her or anyone, or reported in any way, because she made a mistake, she's going to cover it up. But whatever it was that she gave me that wasn't mine, there should be a shortage of them, unless it was some kind of vitamin, but it wasn't a vitamin, it was something I wasn't prescribed to me. And so with all that going on, and me complaining for over a month about side effects that I was feeling, that I was having from the pills, I realized that these doctors and nurses aren't really taking good care of me. They're not noticing what they're giving me. They don't give me the same stuff consistently at the right same time of day, which they should. So I lacked confidence in their ability to keep me safe. So I stopped taking the drugs and everything, also because I was going to stay in for a week, not go anywhere, and I'm going to go off the medication, whatever I'm taking. I would like to be someplace, not alone, and I was testing to see what happened. And then also I had been eating the meat that I want to eat, to Nature's Reserve, a few times, and he brought it back from the last time I went to my apartment, frozen, and when they brought it back to me, then I ate it again to eat it instead of throwing it away. And that time I don't know if I was still allowed in the room or not, but I managed to get someone to cook it for me in the microwave. And then when I came back from that Friday one, that second one, I had brought some more meat with me, 2 of which are either still in the freezer or they got thrown out because you're only supposed to have it 72 days. I brought 2 bags of spinach because I learned that spinach has a lot of potassium in it. So I ate the 11-ounce or 12-ounce bag of spinach plus the meat and all my spices and well, I'm not sure if I had them yet or not. And the result was that for 2 days I had really good blood pressure. And I don't know, it seems whenever I take it in the morning, or as I wake up, or a little time that I get to go and take it, it seems like it's high. And now last night my blood pressure was 134 over, I think, 87, and before that it was 151 or something like that over 78, and then, or maybe lower than 78. And then, but my pulse rate was low, 66, which is where I'd rather it be low, because my heart doctor and I agreed that it was the pulse rate that you could worry about. You get so many heartbeats in a lifetime, and if they beat faster, then you're going to live shorter. And if they beat slower, you might live longer. Just a theory or an idea, but it makes some sense. And so then that's what I did, what I'm talking about, my diary that I'm recording audibly here. So and I was doing exercising, and I was trying to diet, and that had 2 days. This is before I went out Friday, was a few days before that, and I had very good blood pressure. And then it went back up again. Of course, I'm under stress from all this thing, so I don't know how much that stress affects the blood pressure. Now, for the last 2 days, or 3 days, I've had some low numbers, below the normal high number. The low number is 120 over 80. I had it below that a couple of times. So I'm wondering now, is it because of the Haldol injection? Is that somehow long-term? Is it because of eating a lot? I had brought the potassium back, and the potassium and the minerals, the herbs that have a lot of potassium in them, I brought that back, and I used quite a bit of it. And does it linger in my body? Was I collecting it? Is it in there now? Is that why I'm having low blood pressure, which is good? Or is it some other reason? Because you try to, scientifically, you try to figure out connections between things that seem obvious. And then, of course, you don't try to change anything. You only change one thing at a time, because you can change two things. It could be some kind of synergy between those things that makes it worse or better. And I'm no paid scientist, but I'm scientific, and I'm approaching that way, and they don't approach it that way in medicine. They approach it based on their opinions, and the idea that I'm a psychotic or schizophrenic is an opinion of this doctor, and I don't know whether he's my friend or my foe. He tells me one thing about how I'm ready to go home, because it's close to going home, when he came in to release me from the ER to come here. And then Lorraine, I was talking to her the other day, or yesterday, or the day before, and she had a seemingly completely different story about it than he said, oh, he really went to bat for you against suggesting some other persons who wouldn't want me to leave. I don't know what's going on. I know that Lorraine is always ruminating and talking about my refrigerator and my room place being septic and these things, which it wasn't. It was pretty bad when it smelled of mice and it wasn't clean. But she has my key, and she says she gave it back to me. I don't know if she did or not. I know she has my mailbox key, because that's the last time she had it, and I didn't have it. The one that was in the apartment is either gone, or Brandon threw it out, or he put it somewhere, and I don't know where it is. It was in a drawer that is no there anymore, the little dresser drawer, little nightstand type thing. So I don't know if he threw it out or not. All that I don't know about. But I'm recording all this, and now I'm going to stop and hope that I upload it to YouTube, and hope that it's recorded and somehow I get someone to look at it besides me. Thank you, and dear Jesus, please help me. Help me to stay here until I'm able to be healed, that I can go home and walk flat, but also get me out of here by next week. So I don't want to lose another month of my social SSI. I'm getting $35 a month, and I won't have enough money to pay my phone bill and other things now. If I knew that I was going to lose it, I wouldn't have